Good morning, Dr. Desmond White, gastroenterologist. If you are scheduled for a colonoscopy, do the following things before the scope. Number one, tell your doctor all your medication, especially blood thinner such as aspirin, clopidogrel, or Plavix, or anticoagulant like warfarin, Xarelto, or any new direct anticoagulation agent. Because some of these may have to be stopped, and they need to be stopped at different duration according to guidelines. If you continue to take clopidogrel and your doctor is not aware of it, the doctor does a polypectomy during the scope, there may be uncontrolled bleeding. So if you have any medicine, especially blood thinner, tell your doctor. Secondly, we routinely stop the patient from taking the diabetic medicine in the morning of the scope. That's because they don't eat. As you know, if you have diabetes, you take the medicine to drop the blood sugar after just before the meal. If you are not eating the meal, you shouldn't take the diabetic medicine before the meal. So most of the scope, we want you to have no food for 6 hours. For that matter, diabetic medicine should not be taken before a scope. So tell your doctor all your medication before the scope. Number two, 2 to 3 days before the scope, you'll be asked to take a low residual diet. That means less or no fiber. I told my patient to avoid taking vegetable or fruits for at least 2 days. So what can they eat? They can eat fish and chips, steak, fish soup with rice, wonton noodle soup, chicken rice without the cucumber. By the way, fish and chips without the salad. That's because if we take a lot of high fiber diet, they are very hard to be washed away. Number three, you need to complete the bowel preparation that your doctor have given to you. There are different ways to take the bowel prep, but essentially it's the same way. We only have one way to push up all the feces. That's to making you drink a lot of fluid. The fluid will push all the feces out. We let you drink salt water so they're isotonic, so they will not be absorbed. Whatever you drink, they come out, so that in the process of coming out in the anus, they push all the feces out. You have to finish the bowel prep prescribed by your doctor. The bowel prep tastes horrible, tastes very salty. They are not the nicest thing to drink. I tasted it before when I did my scope many years ago. So, but you still have to finish it. If you don't finish the bowel prep, your intestine is not clean, your doctor may have problem in checking your intestine. Most colonoscopy take about 15 to 30 minutes, depending on how difficult the colon is and whether we have to do any therapy like polypectomy. After the scope, you have to do the following things. Number one, do not drive home. Because you have been sedated from the scope, you'll be a little bit groggy. So do not drive home because you may be involved in an accident. In some places in America, the staff will not even let you leave the hospital unless someone picked you up. So do not drive home, take a Grab, take a taxi, or ask someone to bring you home, or you can take a public transport home. Number two, look out for complications such as bleeding and severe tummy pain. The two major complications for polypectomy, for colonoscopy, would be perforation and bleeding. So if you have fresh blood in the stool after the scope, take note. If you have severe tummy pain with nausea after the scope, also take note. Call your doctor's office immediately. If it's after hour, go to the emergency department of the clinic of your doctor immediately. Number three, do not work, go back and sleep. The sedation of give for colonoscopy will make you very tired, very groggy when you wake up. Most patients feel a little bit off, a little bit lethargic, a bit forgetful. You're not yourself. Do not go back to work. Do not go and buy shares, go and buy stuff. Just go home and sleep. And if you're the spouse of the patient after the scope, do not believe the promises, because after the scope they are forgetful. They will not remember what they promised you. I hope this video helped you cope with colonoscopy. Enjoy your colonoscopy. Dr. Desmond White.